Welcome to the Invisalign Professional Whitening System powered by Opalescence. Inside the box are syringes with the Invisalign Professional Whitening System gel and the instructions for use with the Invisalign clear aligners, Vivera retainers, or Invisalign whitening trays. For patients with known tooth sensitivity, it is recommended to administer a desensitizing toothpaste for a few days prior to beginning whitening treatment. To reduce the chance of sensitivity, it is recommended to not use whitening during the first 2 days of a new aligner set. Twist to remove the plastic resealable syringe cap and set it aside for later use. Apply a continuous line of gel inside the trays where the front side of the teeth will be, approximately 1/4 to 1/3 of the height up the interior surface of the trays. To reduce the amount of gel contact with the gums, do not overfill the tray. Applying the whitening gel too high or too low in the trays may inhibit equal distribution across the teeth. When inserting the trays, ensure that they are completely seated for the gel to distribute evenly across the surface of the teeth. Use a wet toothbrush, cotton roll, or gauze to remove any excess gel that may extrude from the tray and rest on the gums. With the tray inserted, rinse with water. Patients may taste a hint of the flavored gel while rinsing. If any tingling or sensitivity occurs during the treatment, rinse again with water and remove any excess gel from the gums with a wet toothbrush, cotton roll, or gauze. Reference the instructions for use and your doctor's instructions for the recommended wear time. When the treatment time is complete, run the trays under water while using a toothbrush to remove the residual gel from both the teeth and the trays. Dispose of the syringe according to local regulations. Some silver fillings may leave a dark purple color in the whitening tray. This is normal. For more information, reach out to your dental healthcare provider.